Great. Hello, my name is Sakpal. I'm the National Program Director for the NPF. Thank you for joining today's webinar on navigating FCS and building your care team. Last year's webinar, we covered FCS signs and symptoms, pancreatitis, and the important role of a registered dietitian. This will be included in the post-webinar email that I'll send tomorrow. Tonight, Dr. Alan Brown will moderate and discuss the role of a lipidologist, joined by Dr. Subramanian on how endocrinologists can support patients. And we will then focus on the mental health impact with Dr. Pandit and Young Lee with a psychologist and patient perspective. But first, I wanted to talk to you more about the National Pancreas Foundation. We fulfill our mission by awarding research grants. We have 189 NPF Centers of Excellence for pancreatitis and pancreas cancer. And also we have 30 programs for providers and patients. We have chapters nationwide. Chapters are a great way for patients and families to connect with each other and local NPF centers. Our annual fundraiser is Pancreas Bowl. If you want to be part of a chapter, connect with my colleague Cheyenne, who is our volunteer development coordinator, and she will get you more involved. And then I wanted to talk about Camp Hope. This is our first pediatric pancreatitis summer camp. It is free for campers and volunteers. It offers connection, friendships, and a true summer camp experience with an on-site medical team. This 2025, we had 201 participants come from 35 states. This year we had 2 FCS volunteers, one being Scott Rivas down here, who some of you might know. He got his whole cabin to walk the FCS 5K with him, which is amazing in itself because Texas is hot. But we take FCS patients who've had pancreatitis, and we are always looking for volunteers. The National Pancreas Foundation is the only organization that deals with all forms of pancreas-related diseases, and we have FCS resources available. The Animated Pancreas Patient provides modules on understanding FCS in the form of videos and expert interviews. We also have a new FCS website as well. You can go to the QR codes here. The resources come from the NPF as well as FCS Foundation and medical associations such as the National Lipid Association. And here, just follow us on all our socials. We post daily. And anyone who has had acute pancreatitis, we have a webinar featuring world-renowned specialist, Dr. Milena Bellin, who's also an NPF board member, and Dr. Daraj Yadav, who will speak on navigating exocrine and endocrine challenges post-acute pancreatitis. And for tonight, our webinar is Navigating FCS Together, Your Essential Care Team. We have Dr. Alan Brown, who is a moderator and speaker. Dr. Brown is a cardiologist and clinical lipid specialist, currently acting medical director of a cardiology at Advocate Illinois Masonic Hospital in Chicago. He's also the professor of cardiovascular medicine at Wake Forest University at Medical School and past president of the National Lipid Association. Dr. Anjali Pandit is the clinical health psychologist and assistant professor of medicine with Northwestern University's Freiburg School of Medicine. She serves primarily in a clinical role and is focused on providing psychological care to patients with GI disease and symptoms. She has been long interested in the intersection and overlap of mental and physical health and the ways in which psychological and behavioral intervention can improve physical health and well-being. And then the Seattle side here, Dr. Suvita Subramanian, she's the medical director at the Lipid Clinic at the University of Washington. And then Young Lee is an FCS patient speaker, patient advocate, and he has had FCS since he was a baby. And he's also the FCS Foundation board member as well. And you'll hear from all of them. And I want to also thank our partners, Arrowhead Pharmaceuticals and Ionis as well. And then after this, we'll ask you to do a webinar survey. We want to hear from you. We do these for our patients. Please fill out the survey by November 30th to win a chance to win a $40 gift card from Amazon. All right, great, thank you.
All right, well, thank you very much. Happy to have a chance to talk with all of you about a disease that is very emotional to any of us who've taken care of patients with FCS. So my job, besides asking some questions tonight, is to talk to you a little bit about the role of a lipidologist. And I just want to start by saying, though I'm a cardiologist, we have lipidologists in all areas of medicine, not just physicians, but endocrinologists, cardiologists, nutritionalists, exercise physiologists, PharmDs. So we've had really a variety of specialties, including nurse practitioners who have not only participated in the National Lipid Association, but have all been presidents of the National Lipid Association in the past. So the specialty of lipidology really crosses over physicians and other providers. And you don't have to necessarily be primarily a lipidologist, but the specialists that I mentioned study the field of lipid abnormalities, both metabolism, genetic disorders, and appropriate treatments. And there is a board exam for lipidology. For those of you who may want to find someone who's board certified in lipidology, you can go to lipid.org, which is the National Lipid Association, and just click on find a member. And then when you put in your location and how far you're willing to travel, they'll give you a list of people who are board certified in your area. So lipid specialists are very familiar with virtually all the lipid disorders and the genetics, and also appropriate treatment. And they likely will have the latest data on what the most up-to-date treatments are. So they're a good reference for you if you need to talk to them. And they should all be well-versed on familial chylomicronemia syndrome. As you know, there is an FCS Foundation, which has lots of information. I'm thrilled that the National Pancreas Foundation is heavily involved in FCS also, because this is a disorder which is often not diagnosed. And you'll hear from our patient that, many people saw him and did not make the diagnosis because it is a rather rare disorder. So it's really important for the patients and also for their doctors that the right diagnosis is made so that appropriate treatment, appropriate counseling can be done. What kind of advice would I give patients to ask their doctor? Well, first of all, ask them if they are familiar with FCS. And if they're not, ask them if they might either refer you to someone who is or get familiar with it. And then secondly, you want to make sure that wherever you're being treated, that there's a dietitian who is familiar with the appropriate diet for FCS, which is still the primary therapy, though now we have better and better medications to treat the disorder. So you're going to hear also from my colleague, Dr. Subramanian, who is not only a lipidologist, she's an endocrinologist, just to show cross specialties, and she's a fantastic specialist in lipid management. And so, Dr. Subramanian, maybe you can talk to us a little bit about your journey, how you got interested in lipidology and the role of the endocrinologist in FCS, and more broadly, how you evaluate somebody when they come in with severe hypertriglyceridemia.
Yeah, thank you, Dr. Brown. And thanks to the National Pancreas Foundation for having me here to talk about this condition, as Dr. Brown said, is very near and dear to my heart, FCS. So I am an endocrinologist. So I did fellowship trained in endocrinology, and where I trained in Washington University in St. Louis, I worked with Dr. Ann Goldberg, who is a lipidologist. And so that's where my interest in lipids started. And then when I moved to Seattle, University of Washington, there was a lot of the early work on FCS, or lipoprotein lipase deficiency, as we used to call it. Was done by John Brunzell, who was a physician and endocrinologist. Actually, he wasn't board certified, but he was a metabolism/lipid expert. And so I started training with him. And so that's how I got into lipids. And over the years, I've met many people in many specialties like you in cardiology, Dr. Brown, and internists. Yeah, that's where my interest in lipids started. And I continued, and I now run our lipid clinic where I see all kinds of rare disorders, including FCS. So I practice in Seattle. So We are a big referral center. Our lipid clinic gets a lot of referrals from all over the area. And one of the big referrals is for people with severe hypertriglyceridemia, where their triglycerides are in the thousands. So when I see people with severe hypertriglyceridemia and their referral, the first thing I do is to make sure there are no what we call secondary causes. I make sure that thyroid function is okay and their kidney functions are okay, that they don't have diabetes, they don't have medications that are raising their triglycerides, to make sure all these other extraneous things are not contributing to the triglycerides. Many people come in, they have diabetes. Diabetes can contribute to severe hypertriglyceridemia. But then how I eventually pick up the FCS folks is when there are certain clues, as you know. The people who have had symptoms off and on have jumped many doctors, have been to doctor after doctor after doctor. Their symptoms, with their symptoms, nobody can put a finger on this, and they've tried medications to lower triglycerides. None of them work. They're not very heavy. They have pancreatitis. And sadly, it's after many doctors they land up in my clinic, and when I take a good history, listen, get their story, and eventually, I pick up people with FCS. And I recently picked up an individual, diagnosed them with FCS just about 6 months ago after jumping around for many years, and he's in his 50s.
So there are a lot of topics to discuss. Some things that I'm interested in, I'd love to learn from you, are dealing with oral contraception, etc., and people with FCS. I know that you have a terrific dietitian that works with you, and your patients have done very well because of it. But maybe you could speak a little bit about the role of the dietitian, and then for our young ladies of pregnancy age, and I have had the privilege of nursing one patient through 2 pregnancies, one with a single child and one with twins. And it's a little bit dicey, but also about oral contraception in these patients, which can sometimes aggravate their triglycerides. And then maybe finish with a little bit about what you counsel them in terms of genetic counseling for the kids.
Okay, great. Yes, I am lucky enough to work in a place where I have a specific, a specialized dietitian who can work with my patients and counsel them on triglyceride, what triglycerides are, where they come from, what kind of foods contribute to the triglyceride pool. So the role of the dietitian, as maybe several of you attended the previous webinar, is crucial to managing people with high triglycerides in general, and specifically to FCS. And as you all know, the main source of triglycerides is food. And so picking the right kind of foods is important. So my dietitian, Melissa, she is bilingual, which also helps. But when I refer my patients to them, she actually goes through their a detailed diet history and looks through the food choices. There's a lot of handouts that the National Lipid Association has. She uses them heavily. They're free to use on what to do when your triglycerides are over 1,000, and what kind of foods to use, a chylomicron clearing plan. So chylomicrons are the particles that carry triglyceride. And so she uses these tools, and the FCS Foundation also has a lot of tools on there to kind of look over the patient's eating patterns and looking at the amount of fat in their food, and counsels them to get their fat intake to less than 20 grams or lower as they're able. So she's a good support system. They are able to reach out to her as and when they need. She will give them all these resources, and she will see them periodically actually, maybe initially, maybe the first year after diagnosis, every 4 months or so, and kind of coach them through this. And that is I mean, having a dietitian in our clinic is, we are a lipid clinic, so I had to fight to get a dietitian to keep them, because there was a point when my previous dietitian retired and they were going to not hire another person. And I cannot emphasize the importance of having a dietitian in a lipid clinic. So yeah, so that's the role of the dietitian in our clinic. And again, the key is your dietitian should know what they're talking about. And I work in a clinic, a diabetes clinic, and we have 2 dietitians. One of them is the one I use, and she has lipid background and education, whereas my other one doesn't. And I have to make sure they don't schedule my patients with her. Not because she doesn't have the specific skill set that is needed for coaching these folks. And so, you can't just give blanket statements, oh, cut the fat, what are we looking for? So that's not helpful. So the average trained dietitian, even if they are excellent, if they don't have that specific skill set, you really need to find the right person to work for folks with FCS. So your next question, Dr. Brown, was regarding specific to probably women with maybe puberty, fertility, pregnancy, and how to get them through, especially if they have FCS. So FCS, where these folks' triglycerides are very high constantly, and so we'll talk about oral contraception first. So oral contraceptives have estrogen and progesterone, and estrogen can raise triglycerides. So people with FCS, severe hypertriglyceridemia of any kind, actually, oral contraceptives which have estrogen are contraindicated because it can significantly increase the risk for pancreatitis. So you really have to be cautious. Many times, these folks, especially women, can be put on oral contraception, they land up in the hospital with pancreatitis. That's a common trigger. And that's how they even manifest, and their diagnosis comes to light sometimes. So very important, the kind of contraception that they use has to be different. You can't use oral contraception. So an IUD is a good option. That's usually what I recommend for women if they're of childbearing age. Pregnancy has to be planned, of course. So my FCS folks, or FCS-like syndrome, who have chronic severe hypertriglyceridemia, every visit or every other visit, they have heard many, many times from me about pregnancy, what happens during pregnancy. They know because you have to counsel them, because pregnancy is another situation which raises female hormones. So estrogen goes up, risk for pancreatitis significantly high during pregnancy. So women who have FCS have to plan their pregnancy, know what happens in every trimester of pregnancy. So because the other thing that happens is, your caloric needs may go up, you gain weight a little bit, and then of course the estrogen goes up. So risk of pancreatitis is very high. I usually, so first they're counseled on what would happen in pregnancy even before they're pregnant. And when they get pregnant, you have to track them very closely. And, I just took a woman through pregnancy. I had been, there's no protocols for this. This is all clinical medicine. I'm curious to hear what Dr. Brown does, but I checked her triglycerides every 2 weeks to kind of take her through the pregnancy. And this young woman, she is 36. She developed pancreatitis at 28, 29 weeks of pregnancy, but she knew the symptoms right away because she had heard me counsel her again and again and again that this is a risk, you have to be careful. And so when that happens, they have to go in the hospital, and their triglycerides are typically very high. And to clear the triglycerides, you have to use this procedure called plasmapheresis, which is kind of like dialysis for your triglycerides. So you have to remove the triglycerides, and we had to do that for this woman. And so she had weekly, this procedure to clear out her triglycerides until she had her baby. So pregnancy is a risk for pancreatitis in women with FCS. So that's something to know. Other periods, other life change periods specific to women during puberty. Again, caloric needs go up. If triglycerides can go up. Again, risk for pancreatitis again. During the menopausal years, again. Things, that when estrogen becomes deficient, I actually don't know what happens at the other end of the fertility spectrum. But usually there's no significant increase in pancreatitis risk unless it's a standard risk, which is, due to, dietary factors, etc. But primarily the issues are during pregnancy and with contraception in women. And for women, and I think the last question you asked about genetic counseling for offspring. So many of these folks are, so I do genetic testing on anybody new that I diagnose or for diagnostic purposes. I know that genetic testing is hard to get covered often. In my institution, the way I do it is the trick is to send them to the genetics counselor because they have wording to get it covered. I know there's testing that you can do, and I'm pretty sure Dr. Brown uses it, and there's other free ways to get it tested for FCS genotyping. But when I test them and we find the genetic abnormality in that person, usually the commonest reason why people have FCS is the lack of this particular enzyme, lipoprotein lipase, and you have to inherit one abnormal gene from mom, one from dad. So it's, both genes are gone. That's the most common, and I'll stick with the common. So when the person with this condition has a kid, they would have passed on one of the genes, assuming their partner doesn't have the condition. So they are what's called heterozygous. And some of these heterozygous people can have high triglycerides. It's variable. So I do sometimes, I mean, it depends on on a case-by-case basis. I will suggest that they get genetic testing, especially if they have adult kids and they have higher triglycerides. But again, I'm curious to hear what Dr. Brown does, but I think it's kind of variable. There's no real.
Yeah, I concur with everything you said. I think that the only issue with postmenopausal is you wouldn't put them on estrogen replacement.
That's right. Yes, absolutely. No, no HRT. No
think,
oral HRT. Yes.
I think the potential fetal and maternal mortality from pancreatitis during pregnancy is understated a bit. Dr. Godet in Canada has actually collected the data on about 47 pregnancies or so in women with FCS. And there was a scary amount of fetal mortality and occasionally some maternal mortality. So I do exactly what you did. And if the patient has been really well controlled on a diet and gets pregnant, in other words, they haven't had pancreatitis in years, I am fairly comfortable just doing exactly what you do, which is get the triglycerides every 2 weeks and keep an eye on them. And if they reach that level where you usually know in your patients what number is going to get them in trouble, if they reach that level, then I would pull the trigger to do the plasma pheresis. My patient that I had to get through two pregnancies, she had 30 episodes of pancreatitis and she was 3. So I wasn't comfortable treating her with diet. So we started her on plasma exchanges right away. The only other thing I know of in the literature, other than, good diet and someone who has responded well, plasma exchanges, is there were a couple of case reports of hyperalimentation throughout the pregnancy, which most patients won't want to do. But I agree completely with you that this can be really dangerous, and it's important to really keep a close eye on patients who are pregnant with FCS. And then as far as the kids go, since they are heterozygotes, the children usually have mild hypertriglyceridemia. They usually don't have severe. But when they decide to get married, it might be worth them genotyping their spouse just so they know what the risk might be. It would be 1 in 4 if their spouse is a carrier of having a child with FCS. So I do kind of encourage the parents to
Yeah.
to remind
Yeah.
their children when they get older that they might want to see a genetic counselor prior to getting married or when they get married, prior to
Yes,
having
that's a
children.
good point. Yeah, yeah. No, yes, that's true. I haven't had anybody who's in that phase of life, but that's an excellent point. Yeah, yeah. I guess
Well,
there's a question. Sakfal just put a question in. How often should an FCS patient see an endocrinologist? I could answer that. So, I am an endocrinologist and lipidologist also, as Dr. Brown pointed out. I have an interest in lipids. And that's the key for someone with FCS or knowing what to do with severe hypertriglyceridemia, the 4-digit triglycerides. Not all endocrinologists are comfortable. You really have to know. So essentially what I'm saying is you have to know the lay of the land. So you have to know who's in your area who can see these kind of folks and refer them accordingly. It could be a cardiologist. It could be an endocrinologist. It could be an internist who has trained in lipids. It could be a family doctor. It could be anybody. So you have to know where the lipid clinics are. You have to, well, I guess just one step back is if you land up in an endocrinologist's office, they should be able to make your diagnosis. And if they are not comfortable taking care of a person with FCS, they should know where to send you. So essentially knowing the who is surrounding you and where your referral base is.
yeah, and I would say again, if you as a patient or as a physician are trying to find somebody, just go to lipid.org and click on find a member, put in your city, and you can say within 30 miles, within 50 miles, and you'll see somebody who's board certified in lipids who should know about this.
Yeah.
I see a question about why wait so long before doing genetic testing. I have the kits in my office. I think this is regional, and in my Chicagoland area, we don't have a lot of trouble getting coverage for the genetic testing, specifically for FCS. And one of the things that the insurance companies look for is when you do a panel. And if it's a panel of all possible diseases, that's when you get into trouble with poor coverage. But if you're just looking for the genes associated with FCS or looking for genes associated with severe hypertriglyceridemia, the cost isn't too bad, and usually they cover it. Now the testing is inexpensive enough that for patients who have no coverage, it's about $249. It used to be $1,200 to $1,500, so it's gotten much less expensive. The kits are free to have in your office as a clinician, and you can simply ask the reps from the different laboratories of your choice, for the kits, and keep them in your office. And they're saliva kits, so you don't have to be able to draw blood. So I think those are all good questions. So before we go on and talk about something which is really important, which is the mental health aspects of having FCS and living with it, because you can imagine that being on a diet that's less than 20 grams of fat a day or less than 10% of calories from fat is a really restrictive diet, and also worrying about having abdominal pain and so-called brain fog and the other things associated with the FCS syndrome can put a strain on the patient, certainly, and also on their caregivers. So I'm going to ask Young to talk to us a little bit about his journey now, and tell us a little bit about when you first found out you had the disorder and what's happened since.
All right. So if you talk about when do I find out, it's like when I was in my teenage years, about 14, 13 years old. But my family knows about it right after I was born. I was born premature, and shortly after I was born, I was on, breastfeeding by my mom, and she noticed that I don't eat, and I cry all the time, and you just like you feel the baby fidget, like all crunch all the time, and that's why the baby is not eating. We need to take him to the hospital. That's what they did. That was you know, 40 some years ago in China, we live in a very poor family, so it's a lot of hardship there. So I was take to the hospital. They put me in ICU right away, and when they draw my blood, they, you know, that's everybody with FCS will know the white blood, milky blood, and they were surprised. But we're lucky enough for that hospital, they treated one patient like that before me. The bad news is that that patient didn't survive. So, and they didn't figure out, you know, by they I mean that the doctors do not know what that condition is. They just know, you know, maybe out of intuition that, you know, since you have a lot of fat in the blood, you should not eat any fat anymore. So they told my mom stop breastfeeding, and you know, let's see what we can do. So I was living in the hospital for a very long time. But eventually I got out. Get out, and so my mom took him out with two messages. One is that this kid cannot eat anything with fat in it, and the other one is a very sad one, which is, you know, the doctor told my mom that this, you know, your kids might not grow, so consider have another ones. That's what they got. You know, back to the time when I find this out, it's like I was very sad, as you can imagine, right? So I grew up up until 13, I was a happy kid, I was curious and everything. And after hear this, it's like, you know, the more you think about it, is like the more it's like, what's the point of all the things I do? And then I realized that, you know, I have, you know, my mom and my dad treated me really, really good, even we're in a very poor family. Maybe because that they do not expect me to live a long life. So it's a good things and bad things about it. So you know, but we do not know what it is. And I think I didn't have any pancreatitis when I live with my family, but things changed when I go out, you know, my high school is a boarding school, and you know, then I go to college in another city. I have to leave my family, so nobody cooks for me anymore. So I have to eat out of the cafeteria, and that's when I got a lot of unexplained, you know, stomach issues, and then I got pancreatitis, and you know, even for pancreatitis, I got a misdiagnosis for you know, just some stomach issue or gallbladders and stuff like that. It took the doctors a very long time to figure out, okay, this is pancreatitis, and they know that I have high blood, but high fat in my blood, but they never make the connection. So, you know, is like my first diagnosis come in 2010. That was my in my 30s. So that's how long it takes for them to diagnose me. So, you know, that's my diagnosis story.
That's such a common story. And what's sad is that if the doctors don't know what's going on, they try medication. We haven't talked a lot about that, but the medications that traditionally lower triglycerides, the fibrates, fish oil tablets, statins, all can lower triglycerides, but in FCS, they don't work at all. They might work minimally, but in general, they don't work. And so then the doctors think, oh, the patient's not following their diet or they're drinking alcohol. And the patient says, what's wrong with my doctor? They don't know what's going on with me. And I'm trying all these medications and they're not doing anything. And sometimes the fish oil can actually cause pancreatitis. So
Yeah.
it's a frustrating thing for and often the doctors and their patients disconnect if they don't know the diagnosis, which is why it's so important to diagnosis made. And with that said, I'm going to turn this over to you and Dr. Pandit to have a discussion. I'm actually really anxious to hear the discussion. I know Dr. Pandit deals with people with chronic illness all the time, and there's all kinds of stressors, not just the physical stress, but the chronic discomfort, but the emotional stress. And you've been very blessed. It sounds like your wife and your mother have been really, really careful, but not everybody's lucky enough to have such a great support system. So I'll let you and Dr. Pandit talk a little bit about this and why it's so important to kind of think about the behavioral aspects of chronic illness. So Dr. Pandit, maybe I'll let you take it from here and talk with Jan.
Thank you so much. And I'm so happy to be asked to be on this panel and involved with this. So just like a little bit of background, I have my degree is in clinical psychology, but that can mean a lot of different things because we can specialize in different fields within psychology. And my specialty is health psychology. So all of my training pretty much has been in the medical setting because I'd really like to use psychological therapies to help patients with medical illness and use the skills of psychology to help with coping, especially with chronic illness. There's so much involved when it comes to having a diagnosis of chronic illness. So I think of my role as a psychologist in this field as wearing a lot of different hats. A few of these I'm sure will come up today as we continue to talk young, you and I and Dr. Brown as well. But things like advocacy, I mean, I've already heard that come up with how arduous the journey is to get a diagnosis. So how like helping a patient be able to speak up and advocate and clarify and be heard by the medical providers. Another thing that I think will likely come up today too is this identity shift. What happens to your sense of self when diagnosed with a chronic illness like FCS? Symptom management, pain is a very common condition with FCS, and psychologists are part of the solution to pain management and can offer some guidance and strategies to help with that. Obviously, the lifestyle adjustment to diet, that's another good place for a psychologist, stress management, and of course, mental health screenings. So, again, there's a place for friends, family, peers, but there's also a place for mental health specialists to make sure we're getting a good diagnosis and good treatment plan so that people can keep on this difficult, arduous journey and also find maybe a new identity, a new sense of vitality within their new context.
So Dr. Pandit, I had a friend who was a psychologist and I had lunch with her once a year. And after each lunch, I felt like I should write her a check. We just talking day-to-day things. She gave me great advice. So listening to Young's story, what kind of things cross your mind that you'd want to be discussing with a patient like him? And then I'll let him ask you whatever questions he has.
Yeah, I mean, I think, the things that stood out to me, like my psychologist ears really stood up is when I don't think you said the word depression, but kind of a bit of hopelessness is what I heard. What's the point, I think is the phrase that you used. That like perked up my ears quite a bit because I think, again, it really comes down to this idea of identity and grief. I mean, I think that's the word that really came to my mind too, is there's a loss that might come as well. And actually being able to name that as a loss might be helpful in kind of getting through it. And really kind of having the support system. I think that's the other piece of it that I kept hearing too. And as Dr. Brown mentioned, you shared with us that you have a great support system, but thinking about how do you kind of find those people that you can trust and that continue to show up for you? That's a question that I had for you as you were kind of thinking about the people that you surround yourself with.
Sure. I think the first thing first, like when I find out like I have a like unnamed disease which with a death penalty there, at first I did lost hope. Like I kind of just functioning as life goes. I didn't talk to anybody about this because I don't think anybody will want to hear about this, and I do some from time to time feel like I'm a burden to people, so I kind of shut off, like do not talk about this. But I did talk about this when I got a girlfriend with my girlfriend. So So I think that's such a life-saving experience, which I told her about this, and she got interested in this. She was not like, okay, you have disease, I'm not gonna, we broke up. And she's like, let's find out what it is together. I was like, I don't care. So it's like I think for my experience when when I'm meeting with other patients, there's always there's some patients were like me, like they are suffering from this and they do not know how to ask for help at all, and eventually they stop doing any search and just like bearing this. And if you have somebody who is genuinely interested in this, or want to find out what's going on, I have to say my first diagnosis was made by my girlfriend. A girlfriend, she read it from a book, and she went through all the Frederick system of lipids problems. You point to this one. This might be you, right? That's my first diagnosis. And my second diagnosis is actually also lead by her. And when I go to, so I in 2005, I moved to the US, and she was like, here healthcare is better. Let's see the doctor and figure out what is going on. And she actually lead me to different doctors, and she even talked to the doctors on behalf of me and say, I think Yang might have this. What is the way to test it? Um, and the doctor said, let me find out. And then the doctor find out there's only one lab in the US, which is in Seattle, can do this type of test. So we connect with the doctor and did the test. Then that's my, the first form diagnosis was coming from. So I think going back, the bottom line is, the lesson I learned from there is that, you should find someone that you can trust, right? And talk about this and be honest with them. Like, what do you think? What do you feel like? What's the symptoms? And um, I think it is the only way you can get help is to let the world know you have a problem, even you do not you do not want to talk about it. I think that's right now I'm not talking so right now it's like if people asking me about my problem, I'm not hiding it anymore, because get the voice out, and even that person do not have that. Um, but if they might chances are they might meet another one, and you hear about this rare thing happened to you and maybe happened to other one. That type of connection can happen. And you talk about identity shift. Like when I first heard, like I first got a diagnosis after I can put a name in for all the pancreatitis attacks I got. Okay, there's a cause of it. There is actually something. Um, there's something real. It's not like because I didn't do good, right? I exercise, I eat well, but I still get it. Why me? And another, get a name, really make you you find a relief, right? So well, you can say it is we have excuse now, but it's really an explanation. Like things will start getting clear and clear from the point on. And another identity shift is happened this after I met another patient. I never imagined what will happen, right? So I went to this meeting and there's few patients gathering together. And when I saw the first patient, and I can't, it's hard to explain. My mind just can't stop. It's literally blown away. I feel like um, you just like feel. Let me put it this way: it's feel like I got another family member. Just find like you think you're the only one in this world are suffering this, and all of a sudden you have a living, breathing person who suffer the same thing with you. And the magic is when you're talking about your life, right? You do not need to explain to them. Like they know exactly what you're having, and you know what they're exactly happening to in their life. It's like how can you explain a person who never had an apple what an apple tastes like? That's what I feel like. How can you explain what I feel like to a person who never had it? But when you have another person who understands you, that's something I never experienced. When I experienced that, I think it's all the weight I'm carrying for such a long time is all went away. And later on it went back, but there's hope. Like basically it feel like I was under a cloud, and then the cloud goes away, and I see sun for a day, and then know there's sun there. And now what I'm doing is to just um, you know look for the sunny days, and there's sunny days in the future.
Yeah, so let's talk about that for a second. So I see from the questions in the post something that everybody should know if you have FCS, which is that there's actually an effective medication that's been approved by the FDA, which is called Tryngolza. And there's another medicine which is also effective in the clinical trials, which likely will be approved in the next few weeks, called plozasiran. And both of those drugs lower triglycerides substantially in people with FCS. So they're the first options beside diet that are effective and can bring the triglyceride levels down enough that they drop you below the threshold for pancreatitis. So knowing your diagnosis, and I've seen exactly, Young, what you say about when you meet other people with the disorder, it's life-changing. And now there's hope about a treatment that we don't know yet whether you could liberalize the diet. We feel like you have to stick with the diet for now, but certainly reduce the risk of pancreatitis pretty dramatically. And both of these medicines have shown significant reductions in pancreatitis. Again, another reason why you want to see somebody who knows something about lipids so they're aware of the medications. But Dr. Pandit, could you just spend a minute or two about what Young just said about knowing they're not alone, and also about having some hope, especially with newer therapies on the horizon?
No, gosh, Young, what a beautiful journey that you've been on. And thank you so much for sharing so very much, because, I think that's rare illnesses like this one, that feeling of isolation and being alone is so pervasive. And just you being able to kind of share what you've been through, I think is likely just so helpful. We are such, human beings want connection so badly. And so it sounds like when you met that other patient for the first time, gosh, to feel so heard and seen by someone who has walked in the same shoes is a really, you described it as magical, and I certainly perceived that as you were describing it. But a few other things that you said that I wanted to just kind of reinforce was that, this idea of, or this feeling of I'm a burden can really reinforce loneliness, because the more that we view ourselves as a burden, we're less likely to share our thoughts and our feelings and our experiences with those around us, because it feels like we're sharing too much and that other people can't shoulder that with us. But then not sharing our very personal experiences that are our reality lead us to feel more isolated and more lonely. And I think what I heard you say is that you really gave people a chance. Like you kind of pushed yourself to say, you know what, I can't assume that other people don't want to do this with me or can't handle this. I'm gonna share it anyway and give them that chance to show you what kind of, if they can show up for you or not.
Yeah, and it's just interesting. Like when I think back about my younger years, I think I convinced myself that I'm an introvert. And the other day when I was talking with friends, and they don't feel that I'm an introvert, because I can be so talkative. I can talk and talk and talk nonstop. but that's not my typical day. And I feel like myself is introvert, but like, you and my friend just check, you need to think about it. And I think about it. Yeah, that's because when I grow up, I have so many pain. I do not want to talk about it.
Yeah.
I usually find a place to stay by myself, and also a lot of social gatherings are so focused on food, and majority of the time those food are greasy food that I cannot eat, and also I cannot drink alcohol, and those things become a pressure for me, which which even I want to go, and those things are dangerous to me. So I kind of maybe mentally trick myself to think myself as an introvert, so I don't have to go out, right? So stay home by myself is good enough, or I better do that. Those things, um, like loneliness, I have to convince myself to be okay with it. Which if you think about it, if you have somebody you can share, another patient you can share, and things can change. I remember the conversation we had with other patients. It's like just first time we see each other, and then we talk about, okay, I have this and this, as those most private things we just talk about. We have this, do you? Oh, the answer could be, oh, I do, and then this must be this disease, or I don't. Oh, this must be not be this part of this disease. So it's that kind of a conversation back and forth help us deep understanding what we're having, and also make like really really deep connections, because those are things you might not even talk to your to your
Yeah.
mom and dad. So
Mhm.
yeah, I'd really recommend, if you can just join a patient group, and if you can just make a phone call, to find someone you like to talk to, make a phone call, um, and or even arrange a face-to-face in-person meeting, um, and at least when you meet, the food choice you make is also good for the other people, and she or her might bring, she or him, he or might bring something you can eat too, so it can be fun, right? Yeah, I used to think like, when I was in those lonely days, I think like, hey, I'm an introvert, I'm okay, just be by myself. But I missed a lot, I have to say.
Yeah. And it sounds like there are some resources for patients to connect with one another through peer support groups, I think is what the Facebook group that was just shared.
Yeah, and actually our foundation, not this month, I think in the month of September, we hosted a in-person patient get together.
And better.
Yeah, we did this two types, now, like last year we did one time, this year we did another one. It is really, really beneficial. I go there and see people's faces, and listen to their stories, and it's really, really empowering, and we build really deep friendship there.
Yeah. That's incredible. I'm so glad that that exists.
Mhm.
Given how difficult it is to find other people with FCS specifically, I would say if anyone watching is looking to connect with other patients in general, even there are some chronic illness support groups out there that might not include the same diagnosis, but may share a similar impact on quality of life that you may still be able to get some benefit from, if you don't have someone in your life that you know so also kind of lives day to day with a chronic concern too.
Mhm. Yeah, and it's interesting. Like when I was young, I thought like, what's the point? Now I realized that the meaning of life doesn't have to be like you go out there and do anything. Like
Mhm.
my existence. So we talk about a patient. We had a really really fantastic friend who passed away this year, who was also a FCS patient. He was, when I met him, he was much older than me, like he's old people. And when I see him, I was like, wow, FCS patients can live such a long life, right? And suddenly I do not worry about that. See,
Okay.
I do not worry about not living old enough to see my kids get married. And before that, I thought I would die maybe really, really soon. I just do not have any hope to see my kids growing up. I have constant worry in about that I will die young and leave my wife,
Yeah.
alone in this world. And then I realized, okay, I am at that time is 30 something now, and for young parents with kids with FCS who worried a lot, and they can turn to me and look at me, right? My existence proves that their kids could have a good life, at least live to 30s, right? So not worry about like die in their 10s, 20s. That was my fear, real fear when I grow up. So that fear got just lifted by seeing another patient who is older than me.
Yeah, and can I ask
And
you,
yeah,
did your girlfriend become your wife? Is this the same girl?
yes, I'm
Okay.
I'm so fortunate. I think I owe my whole life to her.
This proves what
Yeah.
I've always said, that if it weren't for women, all men would be dead.
And right, if there's no mothers and the human the human race is just all gone. I firmly believe that, and through my years of advocacy, I see so many great women, great mothers who really push the research, the advocacy work to go forward. And well, it's like I think they also suffering, but they do not just stop there, just weeping. Like people sometimes think women are weak. No, I mean they're really, really strong, and they're strong enough to let their emotion out, let their feelings out, and cry for help. And when there's just a little bit hope, they'll give 100%. So yeah, for that I don't know how to say, like, yeah, I appreciate, everybody in this field and I appreciate my mother a lot. You know, what my mother did is this, right? So she cook every meal according to my requirement, my diet requirement, to the point that my sister still thinks that her cook sucks. You know, yeah, my mom once told me that, all I need to do is just add more oil in the meal. It'll taste better.
Yeah. Well, thank God for mothers and wives. So, and you were so
And all the
lucky.
support people out there, for
Yeah,
sure.
right.
Yeah.
So lucky to have that.
Yeah.
Well, I think we only have a couple minutes left. And I'm pretty sure that we pretty much got through most of the questions in the chat. So I'm going to ask each of our speakers, including Young, to kind of say a few final words about what should your message be to our audience. So I think I'll start with you, Dr. Subramanian, and tell us what what are the most important points that people should take away from our podcast.
Well, FCS, of course, is a rare disease. If you're the patient, you've heard from Young. You go with your gut. You have to keep advocating for yourself until you find the right person who can take care of you. That's my big, and FCS is a family disease or family condition. Everybody around you has to understand you, whatever your support group is, and not put the pressure on like, oh, you should eat all the food, and so that's very important. So the second is, keep pushing until you find the right doctor. There was a question in the chat which said, how do I find an endocrinologist? I think rather than, so I am an endocrinologist, and as I said, I'm an endocrinologist who is also a lipid specialist. So I can diagnose and treat FCS, but not every endocrinologist has the same skills. So it's very important to find the doctor who can help you find the doctor who can eventually get you there, or you can do the work yourself, as Dr. Brown pointed out. Find go to the lipid.org website and find the specialists, and advocacy. You have to advocate for yourself. In this day and age, healthcare is a little bit of an up and down. You have to be your own advocate in healthcare. So go with your gut, and you do you. It's this is your health. You have a rare condition. Don't stop fighting for your own health is what I'd say.
Dr. Pandit, some parting thoughts about
Goodness. Yeah.
how to support people who are dealing with this illness?
Yeah, well, I mean, I think, as a psychologist, I'm always going to bring it back to mental health, but, kind of thinking about the fact that mental health doesn't mean that we don't have depression, anxiety, trauma, eating disorders, but it means having the right coping tools. So, it is there for you. Certainly there are providers out there that may be able to help, and that you're a whole person. There's physical health, and I know with a new diagnosis, a lot of efforts might go towards physical health improvement, but don't forget about your mental health, your social connectedness, the things that really make you feel like a vital, fulfilled person. That those are really worth investing time in as well, and may actually help you be a better patient in some ways and kind of get back to your physical health. So we'll leave it at that.
My experience over 40 years now, so I can finally quote my experience, is that, using psychologists to help patients who are struggling has been a real godsend for many of my patients. So I appreciate that very much. Young, any thoughts about, final thoughts about what you'd like the audience to go away with this evening?
Sure. I think, FCS limited me or limited patient on their diet, but it did not limit us on life. So, do your best to on your diet, eliminate the fat in it, but live a fun life. Just think about what you like to do, right? If you like to run, you like to swim, do some exercise, and have fun with your family, friends. Maybe they cannot prepare any food for you to eat, but you can bring some to share with them. Just go out and have fun, and do not let this disease define you, and okay. And also enjoy your alone time if you do not want to go out, right? Meditate, pray, and do whatever you do to reduce stress, and life can still be good.
So those are fantastic pieces of advice from everybody. And I'll just finish by saying it's very encouraging to see the progress we've made with this disorder. And one of the nice things about having new drug therapy is that the companies that make these drugs are very interested in educating physicians about the disease process. So there's been a real explosion of information about FCS that's come out to the medical community, which hopefully will help more doctors recognize the disorder. And as Dr. Subramanian said, you should seek out a lipidologist, whether that be an endocrinologist, a cardiologist, or a nurse practitioner who is board certified in lipidology, who could help you, or any other specialist who's board certified. They will help you get to the right people if your physician doesn't know who to refer you to. And not everybody's as lucky as Young was in Seattle and gets to see Dr. Subramanian. And then finally, in addition to the dietary struggles, which I would assume that most patients who have FCS have, figured out a way to pretty much stick to their diet, that we have new therapies, and the new therapies are very exciting. They drop triglycerides by at least half. So that brings most patients below that threshold for getting pancreatitis, which is exciting for us as physicians who've struggled, to treat patients with this disorder, but should be very exciting and give hope to patients with FCS. So on that note, I'd like to thank everybody and thank the National Pancreas Foundation and sponsors for allowing us to do this this webcast. And sponsors include Ionis and Arrowhead Pharmaceuticals. Thank you all for attending.